Hi, I'm Kelly Collins. I'm here with Dr. Richard Schwab, who is the co-director at the Penn Sleep Center and an expert in sleep apnea. Richard, can you tell us what sleep apnea is by definition?
Sure, Kelly. So sleep apnea is where your airway collapses, your upper airway, right about here. Typically, it's related to weight. So most patients who have sleep apnea are heavy, but not everybody. And there's a number of different anatomic features in your mouth that will collapse. And when they collapse, you can't get air in. And your signs will be snoring, stopping breathing. Your bed partner may say you're not breathing at night. You may wake up gasping or choking. And you often be sleepy the next day.
So how would a patient or a regular person come to say, hey, I might need a test for sleep apnea?
Typically what they have, the bed partner complains that they snore. They've often been snoring for many years. Snoring is worse when they drink alcohol or often on their back. And then the other thing that typically patients complain of is daytime sleepiness. So they'll fall asleep watching TV, they'll fall asleep reading, they may fall asleep at work. Some people fall asleep driving. Sometimes they'll fall asleep on the telephone or even eating, but typically it's driving, TV, at work. So the most common symptoms are snoring and daytime sleepiness. There's some others though. The bed partner may notice that they're not breathing it as much at night. They may wake up unrefreshed in the morning. They typically will drink a lot of coffee because they're tired, and it sort of compensates for that. They may go to the bathroom a lot at night, so that's abnormal, and it's typically related to sleep apnea, so they'll end up going to the bathroom 3 or 4 times at night. They'll wake up, again, unrefreshed in the morning. They may be irritable. They may have some personality changes. They may have morning headaches. So there's a lot of different symptoms, but the most common are snoring and daytime sleepiness.
What kind of age range would you say that you normally see people coming in to get tested?
So anybody can have sleep apnea. In children, it's usually related to, and kids and children related to big tonsils and adenoids. In adults, all comers. So you see it in middle-aged, elderly, but again, typically the patients are overweight, but almost any age range. And it's more common in men than women, about 2 to 1, a ratio of 2 to 1 for men to women.
So you mentioned tonsils and adenoids playing a really large role. How about the removal of either of those? Would that solve your sleep apnea issues, or not really?
It does. So in children, removing the tonsils and adenoids works really well. Now, they're heavy and they have other risk factors, other anatomic risk factors that won't work perfectly, but typically in children, the treatment of choice is tonsillectomy or adenoidectomy or both. Not so much in adults, because typically adults don't have big tonsils, sometimes, but not most of the time.
What tests are available to detect sleep apnea?
So there's polysomnography, which is putting on electrodes, bringing you into a sleep lab, and they measure multiple different things, but mostly airflow through your nose and your mouth, and they see if your airflow changes overnight and you snore and your oxygen drops. So that's in laboratory sleep study. And then we do home sleep studies where we don't measure sleep architecture, so we won't know if you're sleeping or not, but we do measure airflow. And that's a little easier. It's not quite as good a test, but it can be helpful.
So for patients who may be, or regular people who may be living with sleep apnea, don't ever feel the need to get a test or just don't think about it, what risks are out there for them for having no treatment or going undetected?
So sleep apnea is associated with heart attacks, strokes, high blood pressure, cardiac arrhythmias, and daytime sleepiness. The daytime sleepiness won't necessarily hurt you unless you're driving, but it's obviously, from a performance standpoint, you're not as performing as well at work. You may be falling asleep at movies and conversations with people, but the cardiovascular risks are high, so that if you have untreated sleep apnea, you're more likely to develop high blood pressure, again, strokes, heart attacks, and cardiac arrhythmias.
What treatments are available for those who do get tested and want to stay on top of their
So
disorder?
the treatment of choice is something called CPAP. That stands for continuous positive airway pressure. And it's a little mask, just like this. This is a nasal mask. It's over, you can see it sort of on me. And there's lots of different masks. There's probably 50 or 60 different types of nasal masks. There's masks that fit over your nose and your mouth. There's ones that just fit inside your nose. So this is a CPAP mask. And what CPAP does, and sort of the way you describe it is how you explain it. It stands for continuous positive airway pressure. So it's working as a pneumatic splint to open up your airway. Just like if you had a pipe that was flexible but closed, and if I turn water on that pipe, if I turn it on with a trickle, nothing happens, right? But if I turn water on strong, the pipe's going to open up. It stays open as long as the water is on. If I turn the water off, it closes again. So CPAP does the same thing. It works as a pneumatic splint to open up your airway. So I'm going to show you some of the risk factors for sleep apnea, why you develop it. This is a normal mouth. This is your tongue. It should stay within the mandibular plane here. This is the uvula, the thing that hangs down in the back of your mouth. Your tonsillar tissue would be out here. In patients with sleep apnea, the tongue is often enlarged and often gets larger than the mandible itself. And you can see ridging on the sides of the tongue. The uvula can be long. The tonsils can be enlarged, especially in children. And you can see enlargement and thickening of the lateral walls, which would go right into these two regions. Now, if you look at, if you cut your head down the middle, that's what we call a mid-sagittal image. This would be your tongue right here. This is the uvula, which is this. And snoring typically is vibration of the uvula in a narrowed airway. If your tongue's large or the uvula is wide or long, this airway space back here is narrow, and you're going to develop sleep apnea. Bony abnormalities can also cause sleep apnea. So if you don't have a strong chin, someone like Don Knotts, who never had much of a chin, he's going to have a very small mouth and be at risk for sleep apnea. Versus somebody like Jay Leno, who has a really strong chin, that's actually going to protect him. When you put somebody on CPAP, it stents open the airway so that the soft palate doesn't hit the posterior wall back here, the tongue doesn't hit the posterior wall, and you will no longer snore. There are other treatments besides CPAP. So there's oral appliances that pull your jaw forward. There's upper airway surgery. There's actually going to just a new pacemaker to pace your tongue, actually, not your heart, but you pace your tongue, called hypoglossal nerve stimulation. So there's a lot of different options for treatment if you can't tolerate CPAP. So the message is if you have sleep apnea, you want to get it treated. Even if you can't use CPAP, there's really other choices. And then anyone who's heavy, typically with a high BMI over 35 or 40, we often recommend weight loss surgery because that can make a huge difference. That not only will they lose 100 pounds and their high blood pressure and diabetes will get better, but their sleep apnea will get better.
How about that? So why is Penn Sleep Center the best place to receive sleep apnea?
So I don't know if it's the best place, but it's a good place. One of the things we do really well is manage CPAP. So we have a mask clinic where people can come by and try on all the different masks for free. It doesn't cost you anything. And it turns out that the interface you get matters. The other thing that we do pretty well is we track CPAP use. So CPAP machines are smart. They have cards in them that can track how many hours you use it, how many days you use it, if it's working, or if there's mask leaks. So looking at those data, you can figure out, well, the reason you're having trouble with it is because you're leaking and we need to change the mask. Or maybe it's not working correctly, we need to change the pressure. The other part of that is we find if you're not using it, then we can think about other options if you really can't tolerate it. So from that standpoint, we do pretty well. We also have a comprehensive program, so we can do the hypoglossal nerve stimulation, the pacemaker, we can do upper airway surgery, we can get you an oral appliance, we can do weight loss surgery, so there's all the options that you need are here.
Good. Well, thanks so much for talking to us today, Dr. Schwab.
All right, bye-bye.